This is Brief Action Planning and Motivational Interviewing, presented by Allison Flanagan, Alice Fleenor, Ann Llewellyn, and Savannah Robb.
So what is BAPMI? According to the BAP Professional Network, BAPMI stands for Brief Action Planning Motivational Interviewing. It's a pragmatic, evidence-informed, and versatile MI-consistent tool designed to support patient self-management and facilitate health behavior change. BAPMI has a relatively short history compared to MI on its own. The first iteration, UBPAP, got its start in 2002. By 2010, it was revised into the iteration that today we see primarily as an intervention in medical and other settings. The theory and foundational principles of BAPMI are stretched across many disciplines. It rests on a solid foundation of decades of theory, development, and research across communication, psychological, and behavioral sciences. This intervention is based on the following theories and principles: self-determination theory, self-management support, self-efficacy, motivational interviewing, trans-theoretical stages of change, client-centered theory, operant conditioning, and cognitive behavioral therapy. Basic recommendations for utilizing BAPMI as an intervention. The first consideration is dosage. The dosage does vary, but BAPMI by nature is designed to be used quickly and in succession. So you might see it utilized very briefly across several sessions with the same client. The delivery setting can vary, just like client needs can vary, but this is often seen in medical or other health-related settings. And delivery of the intervention is relatively straightforward in that someone with some understanding of motivational interviewing and some level of training of motivational interviewing can begin to utilize the intervention. A certification isn't required. However, mastery of the skill can take a long time. So what distinguishes BAPMI from traditional motivational interviewing? BAPMI focuses really on one section of motivational interviewing, which is the action phase of change. So this is most appropriate to be utilized with clients who are ready to go. They know their reasons for change and they just need some support moving forward. Motivational interviewing, however, spans across the trans-theoretical stages of change and is typically done over longer periods of time because it's really designed to help build neuroplasticity in clients' brains. And it accounts for and manages ambivalence, whereas BAPMI cannot. Here are a couple of brief demonstrations. The first of what would be considered non-compliant or poor form in BAPMI, and a second which would be considered better practices with BAPMI. Allison, nice to meet you. I'm Alice.
Hi.
And that you were referred here because there's been some trouble at work. I hear you're habitually late and missing deadlines.
Yes. And I think that there's a little bit more to the story.
Okay. Well, if I were you, I'd really think about how to straighten this out. It sounds like you are really on the cusp of potentially losing your job.
I'm definitely having some problems, but I really feel like I'm having some personal things that are really causing those issues.
Well, I had a friend that had a similar situation, and she really had to just pull herself up by her bootstraps, get to work, stop being late, and start doing what her boss asked her to do. Why can't you do that?
I guess I could take that kind of perspective, but I'm just really kind of struggling, and I don't know. I just need a little bit more guidance there, I think.
So in this particular demonstration, we see that the counselor is very directive and really talking more than they're listening. The client is saying there's more to this story, and the practitioner is just really not hearing them and not helping them dig into the reasons that are causing the circumstance, and also, and most importantly, the strengths and motivation that they might be able to find to take this circumstance in a positive direction. Hi, Allison, nice to meet you. I'm Alice. I understand that you have been referred here, that maybe there's some stuff going on with work. Would you feel comfortable telling me some more about that?
Sure. I've been struggling a little bit in my work. I've been late a couple of mornings, and I've been a little short with some of my coworkers. And I think the reason that that's happening is because I have some personal things going on at home. I have a 91-year-old father that lives in my home that I care for. And my 21-year-old son has been having some mental health struggles. So balancing caring for them has become stressful on me. And it's been affecting my sleep, which has then made me late for work a couple of mornings.
Yeah, so you're really experiencing some things that sound like they're unprecedented in your world, that you're navigating these things that feel new and they're challenging, and you're just trying to figure out how to get through it.
Yeah, exactly.
So when you think about something that would be helpful for you, something that you could implement in the next week or two, what comes to mind for you that could be helpful?
Yoga has always been a very supportive thing for me. And I've really been so overwhelmed with the stress in my home that I've really put it to the side. So that's the first thing that comes to my mind, that I could reintegrate to help me manage my stress and maybe help me sleep a little bit better.
So yoga is something that has been successful for you in the past. It helps you get in your body and out of your head where all those stresses live. So if you were to think about how you can put that step into play for yourself in the next week or two, what does that look like?
You know, I do have a family member that has offered to help me out, and I've sort of just politely thanked them for their help, and then, carried it all on my shoulders in the past. So I could really reach out to them and take them up on their offer, and maybe they could come and take the responsibilities for my dad's care for an evening or two, so that I could actually go to yoga. And that would, I think, be fairly easy, and I would love to do that.
So it sounds like some acceptance of that gift of help that sometimes we don't allow ourselves to take feels like it would be a good step. So would it feel helpful to schedule a follow-up?
Definitely. I need accountability for sure. I think if we don't have a follow-up, I'd probably just get right back into my life and into my craziness and not necessarily do it. So having accountability for sure is really good for me. So yes.
So that follow-up piece, that accountability, sounds like you already innately know is a big piece of this puzzle for you. Thanks for sharing. So we see in this example that the practitioner is much more present with the client, that they are really trying to dig under what is the actual challenge here. There's very little talk about work because the client makes it clear that there are some underlying issues that are creating this challenge, and really the focus becomes on the client, what they know can be helpful, and then the practitioner helps move them through that very brief action planning that allows them to set a goal, take a step, and feel like they're beginning to make some progress. Thanks.
The populations that BAPMI are good that this modality is useful for really are for people who are ready or almost ready for action planning and those who may be resistant or conflicted about self-managing and changing unhealthy behaviors. Like we mentioned before, it was developed for use in medical healthcare settings, like with medical social workers, internal medicine practitioners, and in addiction medicine. It's also been used in psychiatry and social work. And it's also beneficial for use in interactions where time is limited, but change is imperative.
Brief action planning, BAP, and motivational interviewing, MI, are widely used individually in a variety of settings, while at the time of this recording, BAP MI is still in the beginning stages of being used and evaluated at several academic medical centers. Both BAP and MI individually have a lengthy history of research supporting their efficacy in practice. BAP has been proven to be effective in some unique areas, such as comprehensive pain management with clients experiencing chronic pain, acute low back pain, and in treatment with people that have experienced a spinal cord injury. Motivational interviewing has found success in a variety of unique therapeutic contexts as well, including supporting addiction recovery from both alcohol and drugs, and motivating clients to develop healthy diet and exercise habits. BAP and MI have separately been shown to lead to positive health outcomes in a variety of settings. Research seeking to understand the efficacy of BAP MI is in progress. Based on the success of the individual interventions, as well as the current research on BAP MI, it seems likely that further studies could yield positive intervention outcomes as well. According to Cole et al. 2023, BAP MI is an effective intervention in the therapeutic context of working with clients to become motivated to reach their goals. The BAP Professional Network 2022 stated that BAP-MI is particularly appropriate for clients that are either not quite ready to implement change, resistant, or ambivalent to change. It is important that the interviewer that is implementing the BAP-MI approach is able to offer complex reflections to clients, elicit change talk in a climate of acceptance, create an atmosphere of partnership and empowerment, and motivate clients that are hesitant or resistant to change. According to Cole et al. 2023, BAP-MI is effective at helping clients create and maintain healthy lifestyle habits due to evoking intrinsic motivation as a key aspect of the intervention.
So now we will review important areas and considerations, starting with cultural. So little research has been found on BAP-MI within different cultural settings. As mentioned before, it is a relatively new intervention. So there was a research article that talked about the impact of MI across different cultures, and therefore there's some inferences that can be made. Motivational interviewing originated within Western psychology, so it is important to understand how this intervention is received by different cultures and whether it's effective. It was found to be more effective amongst Hispanic, African American, Iranian, and Native American groups that were studied. Results were inconsistent and less effective among the Asian community, particularly Chinese participants. Research did highlight that there was greater success if considerations were made for the ethnicity of the interviewer and the incorporation of the intervention within a cultural tradition, such as eating a meal. So the next area of consideration is related to training. So people need to spend time in being able to learn how to perform motivational interviewing and by association BAP-MI, and it takes significant time to become proficient on both interventions. Significant time is needed to practice the necessary skills, as well as establish a feedback loop, which would require other experts to observe your practice sessions. There are training and certification classes that can teach the foundational skills needed. but these classes can be a significant cost depending on the duration and the scope of the class. A quick search of what's offered showed costs can range from anywhere between $350 to $1,500. And then another consideration is that BAP-MI really does have a lot of flexibility. So the BAP Professional Network highlights 3 different style options within this intervention. So if you're a practitioner and you want to be able to switch up the order, you can do so and tailor it to your client's need. For instance, if the client is motivated to take action, BAP on its own may be sufficient. For those that are perhaps not quite as ready for action, you may need to start with motivational interviewing and then transition to BAP once buy-in is achieved. And if any point that a client begins to waver about whether they're ready for change, you can always leverage motivational interviewing to better help understand their concerns around their plan for action. As been mentioned, BAP-MI is really an intervention that is simple enough to execute and does not require significant investment, since it's essentially 2 people having a conversation. This also allows some flexibility in the fact that it can happen in person, via phone, or virtually. With that said, there are some potential limitations to just consider related to BAP-MI. Some of them have already been previously referenced. So since it's a newer intervention, there is less research that has been done on this intervention as a single intervention, where you will find a lot of research that's been done for BAP or MI. It's also been more focused in the settings, medical settings, as well as regarding health outcomes. So there does seem to be an opportunity for further investigation of using this intervention in other disciplines and other practitioner spaces.
A few additional resources can be found here. The Brief Action Planning Professional Network dedicates a portion of its website to detailing BAP-MI specifically. This website offers a description of the intervention, as well as more links and downloads for those that want to learn more. In 2022, the International Conference on Motivational Interviewing published a presentation titled "A Stepped Care Approach to Self-Management Support and Health Behavior Change." The presentation was facilitated by a variety of health professionals and offers a wealth of information about BAP-MI history, application, and objectives. Stephen Cole is a professor of psychiatry and a clinical professor of scientific education. He has published 50 peer-reviewed journal articles, 35 book chapters, and 150 scholarly posters and presentations, both nationally and internationally. He is one of the founding men of BAP-MI, and he has published a video on his YouTube channel offering a demonstration of the BAP-MI intervention. Thank you.